Practicing evidence-based decision-making. The objectives are to define evidence-based practice and identify gaps and barriers to implementing evidence-based nursing practice. And this is from the Claywell book. Evidence-based practice reflects clinical expertise that is integrated with the best scientific evidence, patient values and preferences, and clinical circumstances. The overall aim is to standardize by maximizing good practice, reducing costs, and improving the quality of care. Evidence-based practice uses a problem-solving approach to nursing practice, involving conscientious use of current best evidence in making decisions about patient care. Magnet recognition is one of the many responses to the call for quality of care of the ANCC's Magnet Recognition Program. This stands for American Nurses Credentialing Center. There are 3 unique key features. The first is problem solving in its approach, which takes into account the clinical experience of the nurse, which is the nurse's ability to use clinical skills and past experience. The second is that it combines research evidence with knowledge and theory. And third, it allows for patient values to be expressed and incorporated in treatment regimens. The problem that gets in the way of putting evidence-based practice to work is that someone says it's just that way, or we've always done it this way. There are 5 fundamental steps. Step 1 is that you have to construct a relevant answerable question from an identified clinical concern. Step 2, search the literature for the best external evidence that addresses the clinical concern. Step 3, critically appraise the evidence for validity and applicability. Step 4, apply the evidence to your clinical concern. And then step 5, evaluate the performance. Next, we're going to talk about independent and dependent variables. 2 examples of common independent variables are age and time. There's nothing you or anything else can do to speed up or slow down or increase or decrease the age. They're independent of everything else. The dependent variable, sometimes known as the responding variable, is what is being studied and measured in an experiment. It is what changes as a result of the changes to the independent variable. An example of the dependent variable is how tall you are at different ages. The dependent variable, height, depends on the independent variable, age. Another example is if you want to explore high concentrations of vehicle exhaust and how it impacts incidence of asthma in children. The vehicle exhaust is the independent variable, while asthma is the dependent variable. The well-built clinical question begins with PICO. And PICO can be the patient, the population, or problem. This could be a disease of interest. The population we're looking at could be an age or gender, ethnicity, or any certain disorder. The intervention is a range of interventions of interest, or it could be exposure to his disease, a risk behavior like smoking. Then you're looking at comparison. What do you want to compare the intervention against? An example would be no disease, or a placebo, or no intervention. Or it could be an absence of a risk factor, like someone who's a non-smoker. And then there's outcomes of interest. This could be a risk of a disease, the accuracy of the diagnosis. Plus you need to add, is the clinical question answerable? An example is, what is the best treatment for recurrent UTI in children? I mean, this is really broad. What you might want to consider is, in children with recurrent UTI, is cranberry juice effective in reducing the number of recurrences? So you see, this is a more focused clinical type question. The literature review process. Searching the literature for the best external evidence is the best place to start. The literature review process helps to track down the evidence. There are many different ways to look up evidence-based practice. Medline is probably one of the largest biomedical research literature database for general information. HealthStar focuses on health sciences, technology, administration, and clinical and non-clinical research. The Cochrane Library helps with informed healthcare decisions. The National Guideline Clearinghouse provides evidence-based clinical guidelines. And the Agency for Healthcare Research and Quality provides evidence guidelines and technology assessments on different clinical topics. To critically appraise the evidence is to evaluate the strength of a study. Critically appraising the evidence means to examine its validity, beginning with the overview. Requires knowledge of the research design and statistics, and involves looking at the research list of the study. There are 3 basic questions to ask. Is it worth looking at the results of this study? Can I trust the results? Are they reliable? Well, what are the results? And are the results relevant for the patient? Questions to ask when performing a systemic critical appraisal is, was the review question clearly stated? Is it likely the relevant studies were missed? Were the criteria used to select articles for inclusion appropriate? Were the included studies sufficiently valid for the type of question asked? Were the results similar from study to study? And what were the results? Apply the evidence. Evaluating performance. The review question should be clearly stated in a title, the abstract, or final paragraph of the introduction. And the methods section describes whatever the research study is and what assessment quality and criteria were used. The results section outlines the number of studies retrieved, excluded, and why. The data analysis section states whether the results are heterogeneous and discuss possible reasons. The summary section provides an evidence summary from the results of several studies. The next step would be to apply the evidence, for the role of the nurse is a critical link in bringing research-based changes into clinical practice. And then lastly, evaluate the performance. Knowledge that has its foundation in scientific study will assist the nurse in making optimal clinical judgments as well as formulating a good plan of care. The limitations of evidence-based practice. While the nurse may have inadequate access to clinical research, evidence, and guidelines, and there's usually large volumes of research to sift through. There's a research language and then complex data retrieval systems. A nurse may be resistant to change, or there could be some systemic barriers such as policies, procedures, and financial accountability. There's cost-benefit issues, bureaucratic structures, and for nurses there may be a lack of consensus among nursing responsibilities, or a lack of communication among nurses and researchers, a lack of skill in locating, reading, and appraising nursing research data, and maybe a lack of organizational support. Not all nurses must conceive of or conduct new research. However, all nurses have the ability and the empowerment to institute change appropriately based on research findings. RNs must base specific interventions in all aspects of the nursing process on scientific research. Now, though there may be a lack of knowledge, there may be a lack of educational preparedness or lack of time, lack of authority to even institute changes based on research. A beginning step in the nursing research process is refining an abstract idea by developing an answerable question that is focused on specific patient-centered concern. Then data collection, literature review, and statistical analysis occur later in the research process. So doing a literature search is to determine whether prior research has been done, can also identify past research related to the study, can assist in defining the variables, formulating a hypothesis, establishing tools that may need to collect data and clarify the problem. It may define the theory or identify additional variables that may need to be considered or controlled. It can also suggest areas that are not well supported by research, and it serves to support the findings. A nurse is testing 2 types of wound care for patients of all ages, genders, and diagnosis. The wound care would be randomly used on different patients. One group would receive one type and another group receiving a second type. What is the active variable? So for this one, I hope between gender, diagnosis, age, and wound care, the correct is wound care. The research will be attempting to manipulate an active variable in an attempt to determine whether this will have a desired effect on the outcome. The active variable in this case is the wound care. A nurse is using the PICO criteria to write a research question. The research question is, in patients with congestive heart failure, will ACE inhibitors compared with the beta blockers improve ejection fraction? Which section is the comparison? Now if we look at this, ACE inhibitors, this comprise the intervention. Improving ejection fraction is the outcome. And patients with congestive heart failure are the patient and the problem. So really, by process elimination, number 3, beta blockers, is going to be the correct answer. In this question, the beta blockers are the comparison with ACE inhibitors.